Hello my dear students, I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. Today we are talking about synovial joints. A separate lecture on types of synovial joints has been uploaded. The link for it is given in description section. Do please see that as well. Meanwhile, let's begin today's lecture, which is typical synovial joint. So, synovial joints are joints where between the two bones there is a joint cavity lined by synovial fluid. Simple, very easy. Let's draw this diagram now for you to understand what is a synovial joint. Okay, are you ready, students? Please get your color pencils out, your drawing books out. Let's now begin our first diagram for today, which is typical synovial joint.
Let's draw the synovial joint, students. Here is one bone which ends in a convexity. We will call it the male end. This is the other bone which ends in a concavity. We will call it the female end. Cover both of these with the help of an articular cartilage. Over the male end, the articular cartilage will be thicker in the center, thinner in the periphery. Over the female end, it will be the opposite. Thicker in the periphery, thinner in the center. Join the two bones with the help of a nice, thick joint capsule, holding the two bones together. Now line your joint cavity with the help of a thin synovial membrane. Remember, your synovial membrane lines all parts of the joint which are not covered by the articular cartilage. Okay, I usually make my synovial membrane dotted because I think that it's a very thin structure and therefore should be given that appearance. That decision is yours. Now take some colors and color your articular cartilage. That completes the diagram of synovial joint.
So that was the synovial joint, my dear students. Let's now begin to discuss the topic itself. You'll be surprised how much these drawing sessions make your brain very alert to further information. Okay, let's begin. Before that, one little thank you from my side for watching my videos. Please give me a like and subscribe to my channel. If you need any specific lectures, then please let me know in the comment section. I'll try and make those lectures on priority for you. Okay, thank you so much. Right. So this is the synovial joint that we just drew. Let me take you through it one last time. So here are the two bones articulating. Here each bone end is covered by articular cartilage, lined by synovial membrane, which secretes synovial fluid. The two bones are held together by a cartilage, by the capsule. Okay, so that's a typical synovial joint. Let's discuss each of the features I told you, bones, articular cartilage and so on. First, let's talk about the bones. As you can see, the one bone is somewhat convex and it's called as the male end of the bone. Okay, it is convex and the other end is somewhat concave. Okay, so these are not very concave, they're just slightly more shallow. Okay, so that is called as the female end of the bone. The two bony surfaces which are participating in the joint formation never really come in contact with each other. They are some distance apart. Why are they some distance apart? How can they articulate then? They are some distance apart because they are covered by articular cartilage. Okay, so now let's talk about articular cartilage. Two bones, one convex, other concave, covered by articular cartilage. Now let's talk about features of this articular cartilage. It's about 1 to 2 millimeter in thickness. It's white, smooth. It's glistening, moist. Okay, if a healthy articular cartilage looks semi-transparent, moist and glistening. It's thick in the center and thin at the periphery. Observe it here. It's thick in the center, thin at the periphery over the convex bone. It's thick at the edges and thin in the center over the concave bone. Okay, just understand that it is enhancing the curvature. What is convex is made more convex. What is concave is made more concave. Right. It is slightly compressible With age, it's going to change. It's going to get brittle, yellowish, okay? The whole surface is lined by synovial fluid and it absorbs a bit of that. When it is compressed, it releases that synovial fluid, okay? Like all cartilages, your articular cartilage is avascular, okay? So where does it get its nutrition from? From that synovial fluid that it is absorbing and from the underlying bone by process of osmosis, okay? So these are all features of articular cartilage. What functions does it perform? Why are we talking about it? It's a brilliant idea. It's a brilliant idea, okay? The function is it provides an ice-on-ice articulation. Have you ever held a cube of ice in one hand and another? You try to move them against each other. It is smooth, frictionless articulation. That's the kind of articulation articular cartilages provide us in the joints. They absorb shock. Okay, when you jump from a height, you are so silly, so am I. Sometimes we take a jump from a height and jump, fall down. When we fall, who is absorbing the shock? The articular cartilage, right? But as you age, so does your articular cartilage. In this image now, see that on this side are the 8 changes. On this side is the normal, healthy articular cartilage. As the articular cartilage ages, it begins to become damaged. When it is damaged, it is replaced by fibrous tissue. Can you imagine rubbing fibrous tissue against each other? Will it be smooth ice on ice? No, it will produce friction and therefore elicit pain. The degeneration in articular cartilage can be divided into 2 types, degenerative and proliferative. As you can see, in degenerative, the articular cartilage becomes thin and resulting in exposure of the underlying bone so that the bone now begins to rub against bone, causing pain. Sometimes the degeneration is proliferative. The aging is proliferative. A bit of bone extends outwards covered by a cap of articular cartilage, forming what is called as osteophyte. What is it called? Osteophyte. So now what we've done is articular cartilage. We've studied its features, 1 to 2 millimeter in thickness, thick over convex, thin over concave. We talked about what it looks like. It's moist, shining, glistening, and so on. Then we talked about how it degenerates, right? Let's now talk about the membrane that lines my joint cavity. All surfaces of a joint cavity are lined by synovial membrane except the area that is covered by articular cartilage. Your diagram is showing that so beautifully. Okay, everything is lined by synovial membrane except the part that is lined by articular cartilage. What function does it perform? The synovial membrane secretes synovial fluid, which will lubricate the joint. It also adds hyaluronic acid to the synovial fluid. How does it matter? Synovial fluid is thick or thin, depending upon presence or absence of hyaline cartilage. Hyaluronic acid, sorry. It secretes what is called as lubricin, which again lubricates the articular cartilage and it removes particulate matter. Now, this is a very important function. Okay, when you have some infection in your joint, as it heals, some leftover particles will be floating around. These will be phagocytosed and removed by synovial membrane. A very important function. Right. So let's talk about the synovial fluid that was secreted by synovial membrane. Okay. So synovial fluid, what does it look like? It looks like a clear pale yellow fluid which is quite viscous. It has an element of thickness in it. It's usually 0.5 ml, not much. It's a very minimal amount present in most joints, but does its job. Hyaluronic acid present in the synovial fluid decides its viscosity. Now we come to something very important. Listen carefully. The more you move your joint, less is the viscosity of synovial fluid. That means less is its thickness. Second, more is the temperature, less is the thickness. Okay? Madam, why are you teaching all this? Why do we have to know all these physical properties of synovial membrane? I'll tell you why. It's extremely interesting. When you learn it, you will find yourself entranced. Sometimes knowledge does that to you. Right. So what does synovial fluid do? I'll take you to the point later. It nourishes the articular cartilage. It lubricates the joint. Okay. Now let's talk about why did we do those properties. Now just imagine you're sitting in your OPD and a patient comes and says, डॉक्टर साहब या डॉक्टर मैडम, ठंड में ना बहुत जोड़ अकड़ जाते हैं. My joints become very stiff in the cold. I don't know what to do. But you are smart. You have studied general anatomy. So what do you tell them? So when the temperature falls, you know that there is increase in viscosity of synovial fluid. So what is happening? Thand mein, in the cold, the synovial fluid has become very viscous. So it is not allowing movement. The more viscosity, less will be the movement, isn't it? So what do you tell him? You tell him, पाजी थोड़ा घूम के आइए, सुबह टहल के आना. Go for a little walk. You're not telling him run. You're telling him, पाजी जरा घूम के आइयो आप. And when then the patient comes back and says, अरे साहब जी मैं घूम के आया तो मेरा तो ठीक हो गया. I'm feeling so fine now. You understand how simple medicine is. It is so simple. You just did the job of telling him to move. Increased movement, decreased viscosity. You understand why we learned the law? Increased movement, decreased viscosity. As the viscosity decreased, the movement began to happen. And you were suddenly a very good doctor according to Paji. Because you did something that all those innumerable medicines somebody else might have given him never helped him. But common sense and properties of physics helped you to treat this elderly gentleman. This is what knowledge should be in its ideal circumstances, and this is how you should practice it in medicine. Okay, I hope you liked it. Let's go on to the next point. Let's talk about capsules and ligaments. There are two bones which are some distance apart. Is it possible for them to articulate? Only if you hold them together, isn't it? Beech mein to cavity hai, there's a synovial joint cavity there. You have to hold them together. Who does that? The capsule. So here you have capsule holding the two bones together. Here you have collateral ligaments, additional supports to the capsule outside, or intracapsular ligaments inside. Okay, so this is how the two bones are held together. Let's learn about this. Capsule is made up of thick collagen fibers variably arranged. See, if they are in one direction only, they wouldn't allow movements in other directions. So they are variably arranged, different directions. They hold the two bones together and they have a very rich nerve supply. See, I've put a red asterisk there. There is a reason for it. I will take you to that wonderful reason. Okay? Right. The capsule is pierced by nerves which are supplying it blood vessels, as well as sometimes a synovial membrane may pop out through the capsule in the form of a bursa. Right. Some places the capsule may thicken to form some intrinsic ligaments which will further hold the two bones together. On the outside, it may be supported by, like I told you, collateral ligaments and intracapsular ligaments. Capsules hold the two bones together. They may be thickened to form intrinsic ligaments. They may be supported by additional ligaments. They have fibers in variable directions, but all of them are collagen fibers, strong fibers. And they have what is a very rich nerve supply. That's what we come to now. What are the functions of capsule and ligaments? They hold the bones together, yes. They help in making the joint stable, yes. They prevent movement which may harm the joint. With this, we come to the watchdog action of capsule. What action? Watchdog action of capsule. Understand. Normally, protective action of capsule and ligaments is happening. How? Capsule is having a very dense nerve supply. So every time you do something abnormal, you just twist yourself into a pretzel, okay? Your body is not happy about it. You're not supposed to move that joint to that extent. This pain that you are producing is picked up by the nerve endings. They carry it to the cerebral cortex. Cortex says, no, this is not the way this joint is supposed to be moved. What does it do? It gives rise to instructions to muscles that are covering the joint to contract. And these muscles now contract, preventing further movement, protecting the joint. Protective contraction of overlying muscles, preventing further abnormal movement. Let's do this once again. Okay, you're moving your joint. For example, now suppose I try to move my finger in an abnormal direction. Okay, immediately the nerve endings of the joint will pick it up, carry it to the cortex. The cortex will make the overlying muscles contract, preventing further abnormal movement. This is called as the watchdog action of capsule. Let's talk about something called neuropathic arthritis. Okay, normally protective action of capsule and ligament protects the joint. When this action is lost, when will you see it lost? You will see it in something called diabetic neuropathy, when the nerve endings become very numb and they are not able to pick up these abnormal movements and relay them in the cortex. So what happens? The person keeps on making abnormal movements. Protective reflex is lost. So he'll keep on walking wrong, injuring his joint without realizing. Finally, it results in repeated damage to the joint, and that is what is neuropathic arthritis. Okay, so this is you will often see these cases when you see your diabetes patients. You will have to warn them to take better care of their diabetes, otherwise they would land up in diabetic neuropathy related neuropathic arthritis. Right. Job of ligaments. All of you must have heard of ACL tear, anterior cruciate ligament tear. Very common sports injury. Okay. And your friends will tell you, the day my ACL tore, I tell you I couldn't stand. Why couldn't you stand? Because stability of the knee joint depends upon this ligament. These ligaments are important aspects of joint stability. Similarly, you have capsular tears. For example, people have injury to their shoulder joint capsule. They begin to complain of repeated dislocation of shoulder joint. You also have what are called as menisci in joint. For example, in the knee, here you are seeing a meniscus. Okay, such menisci divide the joint completely or incompletely into smaller compartments. What function is this performing? It helps in better lubrication of the joint. The joint fluid is able to flow around better. It helps in torsional movement. Okay. And it protects the articular cartilage. See, there is articular cartilage and there is articular cartilage with a disc in between. So the cartilages themselves get protected because of presence of these menisci. Unfortunately, these menisci are also sometimes torn. Medial meniscus tear in your knee joint is a very common condition. And often your patient, these bits of menisci get stuck between the two bones, resulting in what is called as locking of knee joint. I'm sure some of you have heard about it. Okay, so the people say, my leg got locked after the injury. Okay, so that is because the meniscus is stuck between the two bones. The blood supply of joints, usually joints have a good plexus of blood vessels around them from where they get their nerve. Blood supply, and nerve supply is articular cartilage has no nerve supply. Synovial membrane is comparatively insensitive. That leaves out nerve supply to joints is by capsule and ligaments. We've discussed it, watchdog action. So there are some laws in relation to synovial joints. One is a Hilton's law. I'm not going to discuss it. I expect you to read up about it, and please get in touch with me in case you want to discuss this. Alright. So let's revise a typical synovial joint. Ready? Alright. So a typical synovial joint has got two bones which are separated by joint cavity. Each bone is lined by articular cartilage. The joint is lined by synovial membrane which secretes synovial fluid. The two bones are held together by capsules, assisted by collateral ligament and by intracapsular ligaments. The joint may be divided into smaller joint compartment with the help of menisci. May or may not be divided by menisci. With this, we come to end of the topic on synovial joints. This is how you will attempt a question on typical synovial joint. draw the diagram first, like I told you, and then now begin to describe each part of that joint. For example, if you're talking about articular cartilage, you say, what is it? It's articular cartilage, type of hyaline cartilage. What is it made up of? Hyaline cartilage. What function does it perform? You describe it and then talk about functions of articular. For each of the parts that I have taught you, you describe 3-4 lines. Okay, and you will find yourself completing a beautiful lecture completing a beautiful answer on typical synovial joint. It's not difficult at all. I hope you get that question this time. I want you to attempt it and score in it. Okay? Right. Students, if you like this video, do please like and subscribe. It encourages me to make more such videos for you. Thank you so much. The lecture on types of synovial joints has also been uploaded. Please go to the description section for the link and do please watch that. Then only you would have actually completed the topic of synovial joints. Okay? Thank you so much. See you across the screen in some other video, students.